Hi, my name is Tara Sproul. I'm a nurse manager for Nemours Children's Specialty Care in Jacksonville, Florida.
And I am Jenny Pfeiffer. I am also a nurse manager and pediatric clinical nurse specialist here in Jacksonville, Florida, and also work for Nemours Children's Specialty Care. And we are here today to talk to you about comfort positioning in pediatric ambulatory care.
So we'll start with our background and what is comfort positioning? Why should healthcare providers in pediatrics use positioning for comfort techniques? So we go back to the 1980s where doctors thought babies' brains weren't developed enough to process pain and procedures were being performed without anesthesia. So that leads us to common themes in the literature. Pediatric pain is often misunderstood. In one study, it was reported that up to 90% of nurses believe children over-report their pain. Our other common theme in the literature is that children do not feel pain the same way adults do. Data shows that adults receive 2 to 3 times more pain medication than children for the same condition. So healthcare worker misconceptions to not use distraction and comfort holds. So we all know that healthcare workers are typically working short-staffed and in chaotic environments, which leads them to believe there's not enough time. So we looked at the literature and we conducted our own pre-survey, which we'll talk about later. And then also the healthcare workers' misconception that it doesn't work anyway. So topical anesthetics, distraction, comfort positioning, it's just we don't have enough time. It's not going to work. So why are we going to try it? So what exactly is comfort positioning? It's securing the child comfortably to perform minor procedures. So what this does is empowers the caregiver to play an active role in their medical care. So the caregiver is the one holding their own child and making them feel secure. That eliminates the strange healthcare worker restraining a child during a procedure or using a papoose to do it as well. It allows the child to sit versus laying down, which promotes a sense of control, reduces anxiety, and allows the child to be in a secure, comforting hold with their caregiver. Evidence does show that topical analgesics, non-pharmacologic pain management, and comfort holds decrease pain and increase comfort. But on the flip side, if the child's not tolerating the procedure, they're still kicking, screaming, very scared, that's a red flag to let's go ahead and try to abort what we're doing and consider other options such as maybe sedation, general anesthesia in the OR. So Jenny and I looked at our current practice, and we're a freestanding pediatric ambulatory care specialty clinic with 3 sites locally and 23 division that averages about 900 patients per day in Northeast Florida. We do currently have 1 child life specialist who is specifically devoted to our hematology oncology divisions. So that leaves 21 divisions that do not have support from child life and are performing minor procedures daily. Some of those minor procedures we're doing are injections, abscess drainage, G-tube changes, cerumen removal, foreign body removals. And so we recognize that the organization does not have our own comfort hold posters, which do promote the parents and staff helping their child feel secure and comfortable during minor procedures. We don't have handouts on comfort positioning or hands-on educational training available for staff.
And then as far as what exactly did we do for project implementation? So Tara and I, we created a needs-based pre-survey to really see what the staff perception of comfort holds was and what divisions were currently utilizing comfort holds or lack thereof. For example, one of the divisions I'm over is allergy, and there was definitely some opportunity to improve our comfort holds, and we actually piloted in allergy and made our own pictures and kind of put them on the walls before we made our poster that we shared at the conference. Additional data was obtained from child life specialists and other hospitals that have already implemented comfort holds, so we did survey them as well. The incentive to make changes. So in 2018, we actually had several parent complaints regarding positioning and comfort during procedures, specifically, for example, in allergy, in orthopedics, and in radiology. There was definitely some opportunity after talking to the families of things we can do to improve the way we handle different things with kids. Also in 2018, there was a local dentist actually in our local news regarding use of papoose boards and restraining children for procedures that outraged this very community here in Jacksonville. So Tara and I got the official permission, and we took our own papoose boards, and we were able to completely get rid of them from our organization, which was a very liberating feeling. Our process to improve, we removed all remaining papoose boards from our practice. Personally, again, we got to do that. We did education on importance of comfort holds. We reviewed non-pharmacological management techniques. We wanted to really increase the awareness and sensitivity to our patient needs and understand age-appropriate communication with patients. So that was another thing we did as well. Obviously, kids are not mini adults, so we did language. For example, you're not going to say when you take a blood pressure, I'm going to take your left arm, I'm going to take your blood pressure. That can kind of be scary. So again, for example, with blood pressure, we can say, how big are your muscles? Or let's see what kind of numbers you get. So again, the verbiage that you use for your kids, depending on growth and development, really make a difference. So we did some education around that as well. Lastly, we did a hands-on demonstration for staff to learn varying techniques and practice on mannequins. Actually, I raided my daughter's closet, and we brought in giant teddy bears. So people they just didn't hear Tara and I talk to them. It was a hands-on session. So we had these giant teddy bears and even some of our simulation mannequins, and they actually had to practice all these comfort holds in order to make sure that Tara and I knew that they could demonstrate what we were talking about. So it was definitely a very positive outreach we did, and we did it in small groups. So Tara and I went around from division to division. As you know, we have over 20 divisions. It took some time, but we were able to do it, and the feedback was wonderful. As far as results, so again, after we conducted these education sessions, staff were able to describe exactly what comfort positioning was, because again, this was kind of foreign to a lot of people here. As I said before, they were actually able to demonstrate comfort positioning on the mannequins and teddy bears. There was increased comfort positioning used with patients. And again, one of the areas that had an opportunity to improve upon were our radiology technicians. They were trained on specific positions for certain type of imaging. We also created a poster that displays pictures and easy to read descriptions for reference. There are other large pediatric organizations in the area, and they have their own, but it's nice we finally have ours. There are visual references for staff and caregivers, and they can actually, again, with signage, it increases awareness. So by having these large posters in all our exam rooms and all our satellites, they are able to see the different pictures. And again, it could create a conversation for the provider and the family. It also can decrease caregiver stress, as well as decrease child stress and anxiety. And as you all know, anxiety is contagious. We've even trained some of our parents to be distraction coaches as well, which is very much supported in the literature. As far as making sure we're doing it, we do pulse checks. We try to do that weekly when we can, whether it's just kind of randomly walking through clinic or just kind of impromptu surveying our staff members during staff meetings. We, again, want to reinforce the importance of using comfort positioning correctly. And again, it's also reflected in our surveys with Prescaney. And also we go and talk to our family advisory board as well. And it's been going really well.
And so this is our Comfort Holds Quick Reference Guide that we talked about a little bit earlier. This was about a year in the making, and Jenny and I had surveyed all of our sites. So Nemours has several locations up north and then 3 in Florida, and we realized that none of our locations had any sort of a reference for how to actually perform comfort holds, and then advertise it to the families as well, that this is what we have available for you. So as an enterprise, we had representatives from each site, and we were able to create this poster that we do have hanging in our exam rooms that do procedures.
And actually the people in the drawing, so we partnered also, dovetailing on what Tara said, we partnered with AI DuPont Hospital for Children up north in Delaware, and Dr. Patone actually is one of the lead physicians for kidshealth.org, which is actually housed right in Nemours up in Delaware. And these are actually artist renditions of actual real people that I used. My background is pediatric ER trauma. So these are actually colleagues of mine and their children that are actually drawn in the poster. So again, a big thank you to everyone that has helped us with this. So this was a huge success of how everyone collaborated to get this throughout all of Nemours.
So to just quickly go over them and what the actual comfort positions are. So we do have the chest to chest, and this works really well for inserting IVs, for drawing blood, just for doing vital signs. Like Jenny had commented that children can even just be scared having their blood pressure taken for the first time. This is a great way to promote the parent to participate and hold their child while that's being done. And then the leg injections on the table. So you see the one, the top right, the parent standing and the child sitting, and that works well for doing leg injections. So down to the side sitting. So this is used for children who can't straddle, but they want to watch while feeling secure. So again, works well for leg injections, beads, blood draws. This also works well in our ENT clinic for those foreign body removals, cerumen removals. The frog hold, so used for exams or procedures in the groin area. So any catheter placement, pelvic exam, a dressing change, and you notice they have a book in their hand, so you can also kind of block the child's view if they don't want to see what's going on. And then we have the swaddle, which is used for babies needing that face, head, arm, or leg procedure. So it works well for injections, IVs, blood draws, and nasal suction, and ear exam. You can swaddle them, have them feel secure in their blanket, while the baby can also see the parent talking to them. And then the back to chest. So this can be used for older children for arm, chest, or face procedure. So the parent either sitting in the chair, lying on the stretcher, and then holding the child basically in their lap. This is also great for NG2 placement, port accesses, nose or throat swabs, an exam, vital signs, care for face or arm injuries.
And there are others, but these are the most common. So again, you can take this back to your facility and feel free to share. As far as physician support and education is definitely needed, in addition to training ancillary staff on our non-pharmacological management techniques and the importance of comfort holds, we actually targeted more so the nurses and medical assistants for their education, and no, it's an opportunity that we definitely need to round back with our physician and nurse practitioners here as well.
And it's Jenny and I's plan to have more ongoing classes as well to touch those new providers and staff as they aren't on board. It would be ideal to present this culture during their orientation.
And staff have reported that the education was a success, and they're again now utilizing comfort positions within their clinic. Other comments have included fewer people are needed to complete a procedure. Procedures are completed in a more timely and efficient manner. And of course, ultimately, our children are less frightened if they're able to be in the laps of their own caregivers versus a stranger, or if you've all heard the white coat syndrome.
We have not had any more parent complaints about staff ordering procedures and properly restraining their child. And this also now gives the parents a role during their procedure in their child's office visit. Then through awareness and simple distraction, painful experiences can be far less scary for both the child and the families we serve by offering comfort positions in addition to simple distractions. And we really need to also, after the procedure is done, educate the caregivers as well to continue their comfort positioning and distraction at home. Want to make sure we're giving them those realistic expectations. What can they expect pain to look like at home? Will comfort positioning work? What analgesics do they need to be giving and when?
And just lastly, we just wanted to thank you for listening to us, and again, appreciate if you guys have any feedback for us, we can post our email addresses. Again, thank you so much, and we really appreciate it.
Thank you.
Thank you.